The renal system, also known as the urinary system, is designed to maintain fluid homeostasis or physical balance in the body. This requires removal of waste chemicals and retention of water to maintain correct electrolyte and pH balances. The kidney plays the major role in this system, acting as a filtration system for the chemicals in the blood. Unlike the liver, which acts as a sponge for specific toxins until they stop being toxic, the kidney takes everything out of the blood and then only puts back what your body wants to keep. Think of your refrigerator, which hasn't been cleaned in a long time. That is, it probably contains stuff you still want to eat, as well as a bunch of stuff you really don't want to eat. Rather than clean your refrigerator by piecemeal trying to identify and awkwardly remove the spoiled food, best practice is to remove everything from the fridge, wipe it down a bit, and then only put back what you want to keep. Everything else goes in the trash. In this case, the trash can is your bladder. Mix in a bunch of water to create easier flow, and now you've got urine to expel. The primary disorder of the renal system arises from infection of one or more parts of the waste expulsion system. For instance, urinary tract infection are common bacterial infections that begin around the urethra but can travel up into the bladder, to the ureters, and into the kidney. UTIs are often the result of poor hygiene or exposure during sexual activity. For this reason, sexually active women are more likely to experience UTIs than sexually active men. UTIs are often painful and can be easily treated with antibiotics, but if left untreated, can result in much more serious infections, particularly if the infection reaches the kidneys. Injury and infection of the kidney can have long-term effects on the body's ability to regulate waste. This kidney failure, also known as renal disease, is often treated with hemodialysis, which is a process of using machines to filter waste out of the blood. That is, they do what the kidney does. Hemodialysis requires complex machinery, as well as hours of treatment and strict regulations on what patients can eat and drink. For many patients, the mental, emotional, and physical effort required for successful treatment is overwhelming. The extreme dependence on artificial means of survival can also feel dehumanizing. For this reason, treatment of renal disease is associated with many psychological issues, including depression. 12 to 40% of hemodialysis patients meet diagnostic criteria for a mood disorder and were twice as likely to be diagnosed with depression as patients with heart disease or diabetes. However, personality plays a factor in both experience and mortality. One study found that scores on neuroticism and conscientiousness uniquely and significantly predicted survival across a 49-month follow-up period after controlling for other health variables. Therefore, this disorder of the renal system is an excellent example of the importance of looking at psychological experiences in a health context.